Sure.
Right. Hi, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. This is our Friday, February 19th Facebook update on the effect of the COVID-19 pandemic on Mobile County. Want to just thank Sheila for my new mask. Love it very much. Thank you, Sheila, for getting that to me through Josie. So worldwide, we've seen now more than 110 million cases of COVID-19 around the world, with just over 485,000 in Alabama. With regard to deaths, we're nearing 2.5 million deaths worldwide. In the U.S., nearing 500,000 deaths due to COVID-19. In Alabama today, the dashboard was showing 9,573 COVID-related deaths. In Mobile today, our daily report that is produced and sent in conjunction with our partner SSI Group. I want to thank them very much for their continued partnership. Our daily report reports an increase of 47 COVID cases added yesterday. That's a total of 35,330. It's our cumulative total since last March. The number of deaths reported is now over 705 deaths. 6 were reported to us yesterday. And again, remember that deaths and cases were reported to us in the last 24 hours, though they may have occurred in previous weeks. The cumulative number of patients hospitalized with COVID is 4,546. 9 were added yesterday. Just to comment that on yesterday we were reporting on 112, and I had said that increase, that doubling in a day was likely due to closures over the holidays, and it appears that is true. We're back down to less than 50 cases reported yesterday. So again, the number of cases continuing to decline. Yesterday, we had 120 people in the hospital with COVID-19. This is really good news. We've gone from, the mid 140s earlier in the week now down to 120 today, reported yesterday. So that's really good news that our hospitalizations continue to decline. We'll give you an update on the number of deaths to see sort of how that's working when we look at our weekly expanded report on Monday. All right. Had a few questions today, so I just want to sort of remind everyone that we yesterday announced that the first COVID variant had been identified for the first time in a Mobile, Alabama resident. We released a little bit more information on that today, just to say that I guess we actually announced it on Wednesday. That we just want to talk a little bit about the effectiveness of the vaccine against COVID variants. And this is what this means for our community. So both the Moderna and Pfizer vaccines provide protection against the B.1.1.7 variant of COVID-19. So just want to reassure everyone that our current vaccines are effective against the variant that is circulating now in Mobile. Data indicates that it's more transmissible than SARS-CoV-2 among unvaccinated individuals, anywhere from 40 to 50%. It may be higher. We're still collecting data in the United States about just how much more infectious the UK variant is. And individuals who were previously infected with SARS-CoV-2, the parent strain, they're at risk of reinfection from this new variant strain, this B.1.1.7 or the UK variant. So it's really critical that everyone continues to wear face coverings and participate, practice social distancing, stay at home. If you're sick or if you've been exposed to COVID, avoid crowded spaces, particularly indoor crowded spaces, those sorts of things that you need to do to protect yourself and the community until through vaccination we can reach herd immunity. And this will take many, many, many months because we need to get around 70 to 80% of the population vaccinated in order to reach that holy grail of herd immunity to protect the community. So We've received quite a few questions about the COVID variant in Mobile County and what that means. First, I just want to read a statement that we released today, just clarifying some information that was released in the news yesterday. And we just want to make sure, we have great partnerships in Mobile County. We treasure those partnerships. We rely on them. We can't do this without community partners helping us. And so today, we released a statement that the first identification of SARS-CoV variant B117 in a Mobile residence was a collaboration between Coast Diagnostic and Synergy Laboratories and the Mobile County Health Department. So Coast Diagnostics performed the COVID-19 PCR positive test that suggested a patient may have been infected with the SARS-CoV-2 variant. They called me and I said, okay, we need to get that specimen over to Synergy Laboratories where it can be sequenced. So Synergy Laboratories performed whole genome sequencing that confirmed that the patient's specimen contained the B117 variant. So we're continuing to coordinate with both laboratories in this ongoing case investigation and contact tracing. And we're super, super, super grateful for these Mobile-based laboratories. We're very lucky to have these laboratories in Mobile where we can just, move a specimen from one lab over to the other in a matter of 15 or 20 minutes if we need to. And we're grateful for their contributions, ongoing contributions towards slowing SARS-CoV-2 transmission in our community through testing. These are very complex testing that is done in a molecular laboratory, and we are very grateful that both Coast and Synergy are working with us to try to identify and characterize SARS-CoV-2 infections so that we can implement mitigation strategies as quickly as possible. So we can't do it without them. We're super grateful to them. So here are some questions about the variant. Who tests for the identity of the variant? Can this be done in office with test kits currently available? So this may get a little technical, so bear with me. So a rapid test like a Binex Now or the ID Now Abbott machines, the Quidel, the Sophia, some of the other rapid testing platforms, not all of them, these can't detect that you may have a variant. It requires PCR testing, and there are just one or two platforms for PCR that can detect or suspect that we have a variant in the specimen. So the PCR test that was done in our situation is the Thermo Fisher. It detects several pieces of the genome of the virus, and if a piece of it has mutated, then the Thermo Fisher platform can detect that mutation because it causes one of the targets to not be amplified in the PCR machine. So if you pull a specimen and it gets tested by the right kind of PCR, the Thermo Fisher PCR, and it is suggestive that part of the genome has mutated, then if the specimen still exists, then we can send it for sequencing. And so it's not just any test that can tell you if you have a variant. A rapid test cannot, and many of the PCR tests cannot. It's a very specific platform or two that can detect that there may be something different about this COVID-19 positive. So the next question, what's the lag time between sample, test, and identification of the presence of a variant? So this can take from a couple of days to 5 to 7 days. So again, it depends on what kind of test you got the first time, if you still have specimen left over, if it's been kept, what time it gets to the lab for PCR testing, and then once it gets over to Synergy Labs for whole genome sequencing, it can take about 3 days to go from receipt to prep to sequencing to interpreting the results to reporting it out. Both laboratories, Mobile-based laboratories, all laboratories are working to improve and expand testing to be able to do it on larger volumes, on faster platforms. But of course, all these things take time and money. And so I'm just really grateful that we have that capacity right here in our backyard. So again, the lag time is going to be at least a couple of days, but it could be as long as a week. And the other thing is we have a very small window with which to test people for the variant. So, if they're tested by PCR and it looks like they may have a variant and the sample was thrown away, we can only resample them within 24 to 48 hours after that first specimen collected. So it's really kind of tricky to get this all done. All right, how many samples are tested for the type of strain? I don't know the answer to that question. I probably can get it. But right now, we are just catching things as they pop up sort of sporadically. And the state is working towards a statewide surveillance strategy to test specimens in a more methodic, purposeful way so that we have a better understanding about how much transmission of the UK variant is there in the county, where is that occurring, and do we have other variants present? But it's going to take a little bit of time to get this statewide surveillance network established. And that is being done, again, under the direction of the State Public Health Lab, which is part of the Alabama Department of Public Health. All right. It's my understanding that identifying the strain is a 24-hour process to sequence the genome. Can you describe the process? Yeah, so let's see. So it takes about 15 hours, I'm told, to run the sequencing once the prep work has been done, which takes about 12, 13, 14 hours. And it works with a series of what we call primers. So the sample that contains the virus is processed. Some primers go in that can read up and down the genetic material, and that gets amplified and cleaned and tagged, and then it goes into a sequencing machine that takes those little pieces that have been produced and tagged and prepped and determines the content of those small sequences and then pieces them all together. So that's a very crude, rudimentary way of describing sort of how the sequencing works. So if you learned in high school that, genetic material is a set of, A, G, C's, and T's, and that's what the sequencing does, is determines what that sequence of A, C, T's, and G's looks like all along the genome. Let's see. Describe the challenge and the time delay. How rampant in the community could the UK strain be? So the UK strain is, as we know and we've discussed, is more highly infectious. So it has probably been here for some time. It was only a couple of weeks ago that it was detected in the United States, and now it's it's been detected everywhere. So when you start looking, you will find it. I think that it will quickly outcompete SARS-CoV-2. So nationally, they're talking, the scientists and experts talking at NIH and CDC are saying that it likely will be the predominant strain by March. And in general, Alabama and Mobile County has lagged a week or so behind sort of what happens in Florida and the East Coast and the West Coast. So it may be that we're a little bit behind that, but I don't expect it will be much later than April before we are seeing mostly the UK variant in Alabama and in Mobile. So more to come. We will let you know as we learn about more variants. So someone was asking if the reason we're talking about vaccine effectiveness, like why are we discussing that? We're just trying to correct some misinformation that was on social media a couple of days ago that said that the vaccine was not effective against the UK strain. So that's why we continue to iterate that the current vaccine is effective against the UK variant B117. All right. The last thing I'm going to talk about today is a change in the Alabama Department of Public Health isolation and quarantine timeframes for COVID-19 for non-healthcare personnel. So if you're just a community member, then the recommendation to quarantine for 10 or 14 days is still into effect, but there are exceptions, or people who, do not have to quarantine if they meet either of these conditions. So you do not have to quarantine if you have tested positive for COVID-19 in the past 3 months and have recovered, as long as you're not symptomatic. So again, if you tested positive in the last 3 months, if you're exposed to someone with COVID, as long as you're asymptomatic, you don't have to quarantine. The other condition for, not having to quarantine is for people who have been in close contact. They are not required to quarantine, if they are fully vaccinated. So you don't have to quarantine after close contact if you're fully vaccinated, which means that you've had both doses and at least 14 days has passed since your second dose. And you're within 90 days of your second dose. And you're asymptomatic. So if you're fully vaccinated and it's been at least 14 days, but not more than 90, and you feel well, you're asymptomatic, then if you're exposed, you don't have to quarantine. So it's important to know that these guidelines apply to non-healthcare personnel, and there will be other guidelines that will get updated for healthcare personnel and residents and staff of long-term care facilities. So they don't quite get an exception yet, a full exception if they're vaccinated. So we'll talk more about that when the Alabama Department of Public Health updates and releases that quarantine and isolation. So anything, Mark, on Facebook that we need to cover?
Still no first dose.
Oh, yeah. Mark's reminding me that, the Mobile County Health Department still has not received an allotment of vaccine that would allow us to open first dose clinics. So all of the vaccine that we have on hand is already spoken for. We will be doing some second dose clinics next week. You can, check the back of your card to see if you need to come to the cruise terminal next week for second dose vaccine. But we still do not have any first dose vaccine. So at this time, we're still not able to announce any first dose clinics. So having said that, I'll just end my remarks and put on my new mask that I love very much. You guys have a great weekend, and we'll talk again on Monday.